So I want to thank everybody for joining us today. SCIBC's COVID-19 and SCI update with Dr. Andrei Krassioukov and his amazing team, which he will. So without further ado, I'd like to welcome Dr. Krassioukov, although you don't see his wonderful face that we all love to see. But once again, to update us on what is happening in the world, country and province with COVID-19 right now, and people with SCI. As you all probably know, Dr. K has great knowledge when it comes to spinal cord injury. Not only is he a physiatrist and specialist working directly with people living with SCI, but he's also a world-renowned researcher specializing particularly with autonomic function. So Dr. K, thank you for being with us this evening and bringing your team with you, and I'll let you take it away.
Thank you, Terry, very much. And I would like again thank you, BCSCI, to organizing these continuation sessions. I also would like to mention that these sessions initially, specifically for COVID-19 sessions, were supported with our grant obtained from Cognizant Foundation. And I would like to make first disclosure. Actually, Terry very clearly stated, I'm a physiatrist. I'm expert in spinal cord injury medicine. I'm not a virologist. I'm not expert in immunology. I'm learning as COVID-19 pandemic is expanding together with you guys, together with my colleagues at the JF Strong Hospital. We're all in the same boat with respect of novelty of this viral disease. And that's why today what I will try to do to update you what I told you in April when we knew very little, absolutely practically nothing about how COVID-19 affects people with spinal cord injury. In April session, I told you what we as experts expected to see in individuals with spinal cord injury, what we worried about how COVID-19 can affect person with spinal cord injury. Today, I will give you some very little data, what is already was published from experience around the world with respect of this novel condition and so on. That's, as I mentioned, this is a COVID-19 grant which we obtained together with BCSCI. Today, as I mentioned, we will cover national and international status on COVID-19 pandemics. I will give you just slight update on phase 3 COVID-19 vaccine trial. I will give you latest publications update related on COVID-19 pandemic and people with spinal cord injury. And then I introduce you to our BC-based study and introduce colleagues from ICORD, our students who involved in this study and what data, preliminary data we obtained. And then obviously we will try to answer your question at the end of our presentation. This is unfortunately what we see right now from around the world. Pandemic still going on and numbers are climbing up and up and up. You obviously following the numbers. This is an interesting slide. If you can see, and should probably, and when in April we talked, idea was, can we flatten the curve? Can we decrease number of cases detected per day? And if you can look, Canada, United States, Italy, New Zealand, each country responded quite differently with numbers of cases per day detected in country. And this is statistics per 100,000 people. That's why it's some kind of normalized data. It's a true data. And as you can see, for example, New Zealand was able to do quite well in the country. We can speculate why. There is some explanation present in obviously what we learn, how governmental response, and we obviously have to follow up what is happening in each country with respect of protective measures, when they were introduced, how country responded to these protective measures, and so on and so on. But this is a result in reality. In Canada, at some point, we did very well. We saw this curve flatten, and unfortunately, second wave came, as you can see, furiously right now. Right now, we're talking about locking down cities and countries, and we are not in the best shape. We're still doing better than other countries, but still curve not looking very promising at the present time. If we look in comparison with other countries, this is all statistics between Canada, United States, United Kingdom. You see Canada is still doing better than other countries, but still it is a warning sign that we have to do something better, follow advice of our health authorities, listen Dr. Henry, listen recommendations that presently available with respect of distancing, mask wearing, sanitizing, and so on and so on. So this is a general issue with respect of pandemics, and this data, as you can see, I took from the European Center of Statistics on November 13th, just a few days ago. This is our data across provinces. Again, you see each province is going up and down. There are provinces that did quite well for a period of time, like Manitoba was very low, and suddenly Manitoba jumped up so dramatically that it's again not trends that we would like to see, but this is a reality. Let's look on the latest exciting news about virus vaccination. As you heard probably on the news that Pfizer just released the preliminary data on a very small cohort of people, that 90% of people who were vaccinated vaccine was effective. This is a RNA virus vaccination. We still don't know a lot about this vaccine long term. For example, all of you knows that if we compare vaccination for influenza, every year, vaccine for influenza has to be slightly adjusted depending what kind of influenza virus was previous year. We learn about this after years and years of trials and understanding how influenza is changing with every year and so on. And we do know that every year we have to do new vaccine, and then we're expecting if it's 80–90% is effective, it's a great, but every year we have to revaccinate people. That's why we don't know if this vaccine will be once a deal shot or it has to be every year new vaccines. That's why we still have to wait results of FDA and whatever result of Pfizer will tell us about this vaccine. But still it's a great promising data. And we have to wait until science and medicine will tell us results. Let's look on the publications. There are a few publications came out. This was interesting publication from Spain. There were only 12 patients with spinal cord injury, different severities. Unfortunately, this paper did not specifically indicate the levels of spinal cord injury were compared with 12 SCI patients who did not have COVID versus 12 patients who had COVID-19 infections confirmed by the results. And what authors did, they did a very detailed biological assessments of blood proteins, and they compared them blood proteins for various components. First of all, they stated that COVID-19 viral respiratory infections and clinical characteristic in infections in people with spinal cord injury was different. And specifically, they stated that cough and low energy was the most frequent symptoms in this population. Particularly, I was surprised not seeing the level of injury in this paper, because as you know, many individuals with spinal cord injury with a high level of injury have very difficulties with coughing. That's why if person with injury above T67 and higher, possibility to cough decreased dramatically. And if we're coming to high cervical injury, coughing practically impossible. This is one of the challenges, that if cough is one of the most common symptoms of COVID, we cannot detect it in the early stages of this disease. That's why this is a challenging, conclude much from this study. But another very interesting and unusual aspect of the study was that based on protein analysis from 12 COVID-infected patients, the level of proteins which is responsible for our coagulation, organization of clots, probably all of you remember when immediately after spinal cord injury, you have to go through the injection of heparin in order to prevent clotting in the lower extremities and so on and so on. In people with COVID-19 and spinal cord injury, this level of anticoagulation factors was not significantly increased. In contrast, what was expected. In general, we see in people without spinal cord injury significant amount of microclotting within the blood vessels. That's why a lot of people experiencing problems with heart, with kidneys, with small blood vessels, because significant coagulation profile will change. Interestingly, in these 12 people, this coagulation profile was not dramatically changed. And this paper concluded that COVID-19 SCI population did not develop thrombosis, which was interesting, positive, very good news for us as physicians who manage people with spinal cord injury, but we don't know why. So this still has to be investigated. This paper from Italy, the total number of 25 patients were admitted to the one center, 15 were COVID-19 positive. Very descriptive paper, very little data, robust data. And people concluded in this paper that the study does not support that notion that COVID-19 could exhibit atypical clinical features or worse evaluation of symptoms in people with spinal cord injury. That's why it's somewhat interesting and good news that if in April, really, we at Jeff Strong Hospital, majority of physicians, we expected people with spinal cord injury have, and I talked with you about this in April, have decreased immunity, have compromised respiratory function. We expected that significant number of people with spinal cord injury will be compromised and will be predisposed for developing symptoms of COVID-19. The study showed that it looks like not significant number of people with COVID-19 and spinal cord injury were worse than people without spinal cord injury when they contracted COVID-19 symptoms. That's why it's a good news. But again, I really have to emphasize numbers are very low. Only 15 people with spinal cord injury were examined. And this is the last paper which was published since last time I talked with you. This was questionnaire organized by ISCAS and Asia members. It was English and Spanish questionnaires distributed to medical practitioners around the world. And they ask about how you are caring and what are the challenges you're experiencing right now while you're caring for people with spinal cord injury. And results were obviously quite different between the countries, between the regions. particularly participants who replied to survey, stated that people with spinal cord injury frequently experiencing, are still taking that there is a significant concern about infection and fragility of caregivers and so on. There was also concern about fragility and difficulties in the countries where care is quite difficult for people with spinal cord injury. There's particular countries where acknowledge India, South Africa, Latin America. So this was not specifically about people with spinal cord injury, but difficulties, how to challenging to provide care during pandemic for people with spinal cord injury around the world. That's right. Not specifically how it affects people with spinal cord injury, but it was very useful to see this publication for medical professionals, that what we have to do and what we have to be prepared during the pandemics, taking care of this fragile population. So the next, I would like you to introduce a project that my colleagues at the ICORD made decisions that we have to do something to look what's happening in British Columbia, and numerous principal investigators, including Dr. Michael Berger and Andrei Bundon, PIs at the ICORD. Andrei Bundon right now joined this meeting. Unfortunately, Dr. Berger was not able to come for the meeting. And students from our laboratories, 3 of them will talk with you next. And this project was created in collaboration with clinicians in the community. Sarah Leong is a physical therapist from Neuromotion, was part of the investigation. And as well, we included BCSCI, who was very helpful to be in the creation of questionnaires and of course in recruitment of participants in the study. The main goal of this study was to look how COVID-19 impact, first of all, people with spinal cord injury, your mental health. Are you nervous? Are you anxious? Are you become depressed? Second aspect, we want to know how your medical care during pandemic was affected. Are you getting the same amount of care, or care become difficult or different? For example, we have a few questions about telemedicine care and so on. And without further ado, I would like to introduce you our next speaker is Mark Grasdal. And Mark, please introduce yourself and present this preliminary data from this study.
Sure, thank you, Dr. K. So hi everyone, my name is Mark and I'm a second-year medical student at UBC. I've been working with Dr. K for just over about half a year now. So today I'm going to give a brief presentation on some of our preliminary data that we've received from our COVID-19 survey for individuals with SCI. And as you may have guessed, the COVID-19 pandemic has really taken a toll on the mental health of the entire population. So one of our objectives that Dr. K just mentioned of the study was to evaluate the perceived impacts of COVID-19 on the mental health, specifically depression and anxiety for individuals with SCI. So we're pretty pleased with the number of responses that we've received so far. Today we've received 70, and of those 28 were female, 48 were male. And additionally, we're also interested to see if the size of the community plays a role in terms of mental health of our participants. So we've broken down the responses in terms of the size of the community to see if there are different outcomes based upon that. So we split up into both an urban category, which is individuals living in community greater than 30,000 people, as well as a rural category, which we classified as less than 30,000. So I would say the majority of our responses thus far have been from an urban population, although we have received a sizable response from those living in smaller communities as well. Next slide, please, Dr. K. Thank you. So in the survey, we asked each one of the participants to fill out both what's called a PHQ-9 and a GAD-7 questionnaire. So what these are validated clinical tools used to screen for both the presence and severity of depression and anxiety, respectively. So depending on the responses to the questionnaire, each individual will receive a score between 0 to 26 in the PHQ-9 and a score between 0 and 16 in the GAD-7. So I've included these questionnaires for those of you who may not be familiar with what it is, as well as some of the example questions that are in the questionnaire. So for example, if you look at question 1 on the PHQ-9, it asks you to describe if you have little interest or pleasure in doing things. And here you can either rank a score of 0, which is not at all, several days, which is 1, more than half the days, which is a score of 2, and nearly every day, which is a score of 3. And the main idea is that the combined scores of these 9 questions give you a total that can be used as a means of screening for your level of depression. And it's a similar idea with the GAD-7, except for the questions are more directed towards assessing anxiety. For example, not being able to stop worrying or trouble relaxing. So next slide, please, Dr. K. So the scores of the individuals who've responded to our survey thus far are demonstrated in the 2 bar graphs here. The left are the PHQ-9 responses and the right are the GAD-7. So a score of 5 or greater on the PHQ-9 indicates that the individual has at least mild depression, and a score of 10 means at least moderate depression, and score of 15 means severe depression. The scoring system is similar for the GAD-7, so mild anxiety is characterized by a score of greater than 5, moderate greater than 10, and severe greater than 15. So what can we take away from this? Well, our analysis of the responses found that of the 70 participants, 54% of them reported to have at least mild depression. And similarly, with the GAD-7, 22% of the participants reported having at least mild anxiety. So what can we take away from this? Well, it's been reported that the prevalence of depression among SCI individuals can be ranging anywhere from less than 10% all the way up to 60%, depending on the study, location, and circumstances of the participants involved. So the results that we see here are on the higher range of the spectrum. So it is possible that COVID-19 has affected the mental health of these individuals, and we really hope to gain more information about this during the second part of our study, where Nick later on will describe shortly, will consist of semi-structured interviews of some of the participants that have agreed to be a part of that. So next slide, please, Dr. K. So I mentioned earlier that we're also interested to see if there were any difference in terms of depression and anxiety rates, depending on the community size of the individual. And thus far with the data that we've received, there's not enough evidence here to state that there's any significant difference, although we are hoping to kind of find some of the unique challenges in terms of individuals living in rural communities versus urban communities within our semi-structured interviews as well. So thank you everyone for your time, and I will pass the floor on to Adam next.
Thank you, Mark. Next slide, please, Dr. K. So hi, everyone. My name is Adam. I am a first-year medical student, but before that, I was in Dr. K's lab for a year and have sort of continued on through that, continued with him. As part of our study, we're still very far from completion. So what I decided to focus on today was also more on the quantitative side of things and to leave the more qualitative or experiences that we get from the interviews until that's being done by Nick and Dr. Bundin. One of the new scales that we had in the survey was the Fear of COVID-19 scale, which was developed or published in March of 2020 in Iran. And at this point in time, I believe when they were making the questions, they used coronavirus 19 rather than COVID-19 because the formal name might not have been fully implemented at the time when they were designing the questions. But they found 7 questions that were validated, that they found significant validity for. And of these 7 questions, next slide, please. They often, unlike the PHQ-9 and the GAD-7, which asked people on a daily basis, did you have this once a day, nearly every day sort of deal? These questions ask people to agree with the statement. And so I wanted to pull out 2 statements from this survey. The first one was, when watching news and stories about coronavirus 19 on social media, I become nervous or anxious. And for this statement, individuals were asked to either strongly agree at the top of the graph or strongly disagree at the bottom of the graph. And this was compared to either our GAD-7, which is the anxiety scale, or the PHQ-9, which is the depression scale. You can see on the vertical axis is where we've got the COVID-19 fear scale points. Now, zooming out a little bit, I decided to compare the scores of the COVID-19 fear scale to the scores of the anxiety scale and the depression scale that we had earlier. Interestingly, you see in this specific scale, this is the same question. And the slide on the right is the anxiety scale, which I just showed you. The slide on the left is the depression scale. And as you can see, there is a correlation between having greater fear of COVID-19 and being more anxious or reporting more symptoms of depression. If you could go to the next slide, please.
Adam, just a second. That's a correlation is a straight line. If straight line going up, this is a correlation with showing straight line.
Yeah. So,
Don't forget.
as as people reported higher levels of depression, there would also be higher levels of fear. But that was the trend that we were seeing here. But on the other hand, one thing I wanted to point out in this next question, I cannot sleep because I'm worrying about getting coronavirus 19. Even though there was this same trend, what I did find is that many of the responses were on the bottom half of the graph. And the bottom half of the graph is composed of neither agree nor disagree, disagree, and strongly disagree. So even if there is that trend between depression, anxiety, and fear of COVID-19, the fear of COVID-19 might not be as strong as the depressive symptoms or the anxiety symptoms, which I thought was an interesting thing to highlight. And that would be the main takeaway here. Could you go to the next slide, please?
Sure.
PHQ-9, or the depression scale, and the anxiety scale, both are reporting high numbers. And that's what people are reporting themselves, that they're worried about, social isolation and the impact on their mental health. Interestingly, I think this is a point of caution perhaps, is that even though telerehabilitation has increased, and this is the bottom 2 graphs, telerehabilitation has increased during COVID-19, going from 5% before COVID-19 to 17% with our sample size of 70 people. People are still reporting, having challenges with access to accessible exercise facilities. So telerehabilitation, while it's able to continue providing telerehabilitation, maybe not everyone is using telerehab, or maybe exercise facilities on their own are providing an important area that people want to see continue or want to see addressed. And that's it for my part. I can hand it over to Nick Dean, and we might need to go back to Dr. K's.
Okay, awesome. Thanks thanks for the introduction, Dr. K. And thanks, Mark and Adam, for everything that you've kind of brought everyone up to date with everything. My name is Nick. I'm a 3rd-year PhD student in the School of Kinesiology. And my supervisor is Dr. Andrea Bundan, who's one of the co-Is on this project. And what I'm going to detail here are kind of the next steps. And Mark kind of alluded to, and Adam alluded to this as well, but what we're hoping to do now post-survey is to also use a number of qualitative interviews with individuals to further explore the topic. And in drawing attention to objective number 3 that was outlined by Mark earlier, it was to develop recommendations to support individuals with spinal cord injuries and other physical disabilities during the pandemic period. So with this in mind, what we wanted to do was focus, or what we're wanting and intending on doing is focusing in on people with spinal cord injuries experiences of COVID and their access to or not access of healthcare services during this time. So what we're hoping to actually end up doing is interviewing 12 individuals, and out of these individuals, 6 will be from the rural or small communities that Mark outlined, and 6 of these individuals will be from the medium or large scale communities that Mark had outlined. All the participants that we will interview will be individuals who had indicated some use of telehealth or telerehabilitation. And the reason that we're doing this and choosing to speak with these particular individuals is because we want to really highlight their experiences with telehealth and telerehabilitation, and to kind of and to kind of build off of what Adam had noted there. We just really want to explore what some of the barriers perhaps are for people accessing these programs and services. In addition to that, we're going to be using maximum variation sampling, and that's really in order to explore a range of different experiences. So within the sample and within the people that we recruit, we're going to be looking at a number of different factors and trying to get a very diverse sample in terms of the level of injury, different genders, different ages, different types of services accessed, and of course, as I outlined above, people from different areas of the province as well. And really kind of moving forward, what we're hoping to do is use semi-structured conversational style interviews. And these are really intended to, as Mark and Adam have alluded to earlier, is to provide depth and nuance to some of the survey results that we've gotten, and to provide kind of context to some of the numbers and trends that we've already explored. So those are kind of the next steps that we're hoping to use moving forward.
Thank you, Nick. That's in conclusion, I would like to mention to all participants that this research project was created in keeping in mind the goal that we as a scientists and clinicians wanted to know where should we go, where we should focus with our directions based on opinion and desires of community with spinal cord injury. And it's really, really you guys, you directing us what is needed for community with spinal cord injury right now in this challenging time. But presently, what we have to do, we have to listen experts in health organization, experts in virology. Science has to be behind all of our actions. I will encourage all of members of BCSI community and all patients with spinal cord injury, review with your family physician, with your physiatrist, your vaccination plan, including flu vaccine, pneumococcal vaccine, and shingles. It's all issues related to viral vaccinations. Wear masks, wash your hands, keep the distance, and if something happened, clinics are open. You don't have to scare to go to the hospital if you need to look for the help. You know that Blossom spinal cord injury outpatient care is open. GF Strong outpatient care is open. We don't know what will happen in the next few weeks. We're watching very carefully, but in a hospital, we're wearing protective equipment. You will wear protective equipment. You will be examined. That's why you have to make decision what is needed. That's why do come to the hospital if definitely you need to ask for the help. At this point, I would like again thank you all my colleagues who helped with this presentation, and we're open for questions.
Amazing. Thank you so much, Dr. K, Mark, Adam, Nick. I have lots of questions, but I can ask them at another time. Also, Jocelyn typed in the chat there. I think the survey is still open, you guys, right? So
yes, absolutely. Survey is still going on, and we would like to see more participants from the rural community, because this is one of the most challenging, probably, community where to get help. That's why we definitely at ICORD would like to see more participants from community, in any community, but really rural community is a focus right now.
At this time, Joss, any questions that you see?
I do, but I just first want to see if there's anyone on the phone. I like to do them first. I think we may have one. Okay, we'll move along. So Gordon, do you want to start first?
Sure. Hi, Dr. K.
Hello.
When the pandemic first started, I found it very depressing, especially with all the people that were passing away in extended care homes and things like that. I found that as the levels sort of flattened out in June, the anxiety sort of disappeared. But what I am finding right now is that my pain level, because of inactivity, is really increased. And for that reason, it's becoming more and more evident, the fact that I'm getting more and more, I guess you'd call it, depressed.
Oh, I totally agree with you. We do know that pain level is very closely associated with mental health of person, even without spinal cord injury. And physical activity level, if you don't do enough stretching, if you don't do enough going out and doing just wandering around, it will be also negative impact on your mental health and pain levels. That's why it's double-edged sword.
Mm-hmm.
That's why I will encourage, talk with your family physician, talk with your physiatrist. If we cannot increase your level of activities, we have to adjust level of your pain medication. We have to look maybe for some period of time, look on some support for your maybe antidepressant. And we do have some medications that actually have both positive effects on combination of both depression symptoms and pain level at the same time.
Mm-hmm. Yeah, I just find that without going out all the time and, you know, bouncing over the cracks and sidewalks and things like that, my whole body doesn't seem to get as much of a workout.
Yeah,
it does just by using a Motomed or something like that.
totally agree, totally agree. That's why I will encourage all of you, find something to do home, whatever little space you have at home, whatever little exercise equipment, like with TheraBands. TheraBand looks like very simple exercise, but they will help to stretch neck, upper shoulders, girdle muscles.
Okay. Thank you, Dr. K.
Thank you. Good question.
Next, we have John. You can unmute yourself, I think. Yeah, there we go.
Thanks. Great presentations, Dr. K and everybody. And Andrei, I commend you for getting your students involved and letting them present. I think that was awesome to hear from them. When I was presenting, I'm sorry, I can't recall your name off the top of my head, about the anxiety and depression scores that you were getting from the preliminary results of the survey. I've anecdotally heard from a few people that they suspect that people with spinal cord injury are, in a way, sort of predisposed to being resilient to the circumstances around this pandemic, this social isolation, and some of the challenges that have come with it, and having gone through a traumatic injury and the recovery process following that, and oftentimes a bit of social isolation because of lack of mobility and things like that. I'm wondering if you guys have considered that in your assessment of the data, because looking at those scores, they actually, to me, looked quite low. I would think that the general population's anxiety and potentially depression scores were at a par, if not higher, than the average person with spinal cord injury. Just wondering what your thoughts are on that.
That's why, as Mark mentioned, depending on the study, depending on the country, the range of depression varied so dramatically. That's why we're showing you only preliminary data. If we're looking on a range of depression in general SCI population, it's ranging from 10 up to 60%. We're showing it is right now about 53 depressive symptoms, and we're not subdividing them from the mild to severe and so on. That's where within the range what is shown in general population. Our next step, what Mark mentioned, it will be great to definitely distinguish what is the background component of mental health, which was before the pandemic, versus what added by pandemic aspect. And this is a big question to answer. That's why, again, John, it's a great question, and we have to tease it with our future analysis. And actually, I wanted to, is that you will ask me a question you asked me a couple of days ago, because that's why I was so excited to show this paper on thrombosis, because this is exactly a question you asked me a couple of days ago.
Mm-hmm. Do you want me to re-ask it? Well, no, I did. I was lucky enough to talk with Dr. K a few days ago, and one of the questions I asked is that, you know, they're noticing that the way that the symptoms present from COVID-19 in people with spinal cord injuries is somewhat different than it is for the general population. And, you know, being that it is an inflammatory disease, particularly in the respiratory system, you know, thinking that coughing can cause irritation to the lungs and the throat and all that respiratory tissue, that maybe the fact that a lot of people with higher level injuries aren't able to produce a very strong cough is causing less of that inflammatory reaction in the lungs that maybe non-spinal cord injury people are causing more inflammation due to their coughing.
Yes, that's my answer to John at that time was, first of all, coughing is a good protective mechanism in our body, because with cough, we're cleaning out whatever junk we have in our lungs when we have bronchitis or pneumonia. We're propelling it up to removing this gunk which will be accumulated in the lower portion of the lungs, because lungs cannot move it out. That's the only cough mechanism we have. And the person with spinal cord injury, as you know, many individuals who have high level of thoracic or cervical injury, we in the hospital, we're teaching you how to do assistive cough to help to do this lung hygiene. That's, I don't think so. Without the cough, it is a good idea to not cough and so on. But what interesting, what is this paper showed from Spain, that inflammatory processes, protein responses, looks like totally different in people with spinal cord injury. And that's why, John, it's very interesting questions that it is looks like people with spinal cord injury respond differently, absolutely differently with inflammation, differently with the blood clotting, but we still don't know a lot. Again, you saw data, 12 patients, 15 patients. We need more data to answer in more details how these processes evolve in the SCI community.
Can I just
follow that? Oh, sorry, go ahead.
Question, sorry, Jocelyn. Dr. Kate, you also talked about these vaccine trials that have been published, and they're talking about 90% protection rates or 94% protection rate, but the number of people that were in these trials is really quite low in the grand scheme of things. And the results they're publishing are based on like less than 100 cases of people that had the vaccine and caught the virus. Can you like maybe make that more understandable for us? Because it's kind of complex the way they're using those numbers to say how useful these vaccines might be.
Okay, I again will tell you, I'm not virologist. That's why right now, the Pfizer data, preliminary data was not on even 100 patients. I believe it's only like 30 patients who were inoculated with vaccines. They were not positive for COVID before. They were inoculated with vaccine and they were followed for a period of time and they were not infected by COVID. That is, this is what they were not treated from COVID, they were prevented from COVID. And that's whatever cohort of people they injected with this vaccine prevented these people to become infected from COVID. This is the goal of vaccine. The same what we're doing with the flu vaccine. We're doing vaccination before you will catch the vaccine. And then we know that it's about 90% of people who get vaccination will not catch a flu, or the flu symptoms will be much less than in the 10% who will develop flu and will significantly will develop full-blown flu, even the fact that they got vaccination. Did I answer your question? That's it's not a treatment, it's a prevention. Vaccination is a prevention from COVID.
All right, I think that we're going to move on. That's a really interesting question. Dr. K, I had a question kind of related to that. You mentioned in the last time you gave your COVID-19 presentation back in April that as much as we understand from the literature, people with spinal cord injuries have at least some degree of immune deficiency or immune dysfunction. It's hard to know, but it gets worse with higher injury levels. So I'm curious whether there's any concern or any information on how people with spinal cord injuries, especially those with higher injury levels, might respond to a vaccine like the RNA vaccines that have been announced in the last couple of weeks, and whether we would just expect that to be no different in effectiveness for our population.
So I have no idea. Answer about immune deficiency, yes, we do know that it is a long established fact, and there are few laboratories around the world demonstrated that immune response in people with spinal cord injury is declining and immune system is compromised. It's fact. But I cannot answer this question. I don't know. So far, we don't have, for any, so far as I know, vaccination contraindication as a spinal cord injury, contraindication for any of the vaccinations. We're doing pneumococcal vaccination, which is a not RNA vaccine. We're doing influenza recommendations. That's why so far spinal cord injury is not contraindication to do vaccination.
All right. Does anyone else have a question? We've got a couple minutes. We've certainly got time.
I definitely have a few, if everyone is okay to bear with me to ask. Okay, Dr. K, I know you're not a virologist, but what do you think, like, so now Pfizer's all excited and all the news is all out and everybody's just waiting for this vaccine. What is the sort of realistic expectation for the vaccine to come out at this point? As John suggested, it's only been a few people that have been tested.
Typically, if we're looking on the normal time frame of any drug to go through process of testing and FDA or Health Canada approval, it's about 5 years. Some drugs will get what we call special authority or expedited process. That's what is my understanding. Pfizer is planning to apply for expedited approval. As you hear, it's from the news. Looks like Pfizer expecting that vaccine will be approved by FDA as expedited approval in January 2021. The next question I will ask, and I will look forward to hear from news or from Pfizer, how many vaccines they can produce in a year? We don't know. So far, I didn't hear this. And as I understood from Trump administration that they already purchased everything in advance.
Okay. So my next question for you before I move on, unless Jocelyn, there's something by the...
I was just about to say that there was a release from the federal government in Canada saying that there were agreements to order, I think it was 5 million vaccine doses from each of the major vaccine efforts. So fingers crossed.
And as you know, Pfizer is not only one company that is working on vaccine. There is about 8 or 10 vaccine different companies are in a progress. Some, as you know, some clinical trials were stopped. One trial renewed again in Brazil. That's right. It's still very, very hot and
Andrea is putting a bunch of stuff in the info there in the chat box. It's interesting too.
Yes, she says 1.3 billion is the estimate of doses, 20 million from Pfizer, but it requires 2 doses, so 10 million individuals would.
Okay, thank you. Yeah.
Terry?
So this is always my concern, Dr. K. I'm sure you can't answer it, but I honestly do not know what the difference is between, I know scientifically, I guess, but like in my body and how it feels to me, the difference between pneumonia, the flu, and COVID. Like, I just feel every time I get like a cough or an itchy throat, I start kind of panicking. And I don't want to have that anxiety over it just from a cough, because it sounds so much like pneumonia when you talk about cough and low energy.
I totally agree with you. This is unfortunately reality, that all these symptoms of COVID overlapping with a general influenza, pneumonia, and other hundreds of different conditions. And until you will be tested, you don't know what you have. Okay. I totally agree with you.
Can I ask more questions? Is it okay?
You are the boss.
There's no hands up, so I'd go for it.
Okay, so Adam and Mark, for you, I'm really excited to see, and thank you for sharing where your research is going and the tie-in to what Nick is doing. And so it's really nice to see that you participate in a survey and you're actually going to get some results and recommendations out of doing that survey and how we can help ourselves during the isolation. Thank you for that. And that's why it's really important to participate in these surveys, is because of that. We want to see what those recommendations are and how it can help us, right? So anyways, my question for you is, are you also showing data based on level and AIS grade at all? And if that has any effect on the results?
We did ask a question in the survey regarding that. We have not compared that to the scores of the PHQ-9 and the GAD-7, which we're currently using as a surrogate for mental health, but that is coming down the line. And if we get something interesting, I'm sure we'll let you guys know.
Awesome. And then I also, someone in my work had set me off on this. I just sent Jocelyn a link, the CMHA, and I sent it to you guys, the results of their mental health. And how do you think that sort of, I guess, you know, pertains to your guys' data? Is it similar? Is it, yeah, what have you found? Have you seen that?
Thank you for your kind words earlier, Carrie. Yes, I took a look at it. And with regards to that data versus our data, the report you sent, and I think you posted it in the chat as well. Yes, thank you. Is definitely enlightening and is presented in a very easy to read manner. They don't mention the specific cutoffs that they used. And I do know that some of the scales that they use in there are slightly different from the scales that we used in our survey. So right now, broadly speaking, the conclusions that Mark, or the takeaways that Mark mentioned when he was talking about PHQ-9 and GAD-7 still hold. He was saying that we found these depression or symptoms of depression and anxiety in on the higher end of things, and compared to the symptoms listed in that handout, they were a bit higher than what they had listed. But the handout looked at, you know, just disabilities in general, or Indigenous populations in general. And I don't know how different or how our view is going to change once we have all of the data and do a proper comparison. John made an excellent point earlier about resilience due to the injury itself, and that is something that we will hopefully elucidate with our semi-structured interviews.
Mm-hmm. Thank you. Just another question. Oh, there's a hand up.
I have a hand up, but you can finish your question.
Okay, I was just going to ask, I guess, sort of Nick, with your part of the study that you're doing, how does one get involved with that? Is it selected through during doing the survey, or yeah, can you talk about that a little bit?
Yeah, no, thanks for the question, Terry. Yeah, so at the within the survey, you can you can leave your contact information, and we can reach out to you with regard to having an interview. As I mentioned in my discussion, we're actually selectively picking who we want to talk to, just because we want to speak with people that have at least engage with, to some capacity, telehealth and tele-rehabilitation services, just because that's one aspect that we're kind of interested in exploring. But you can, your contact information can be kept and privately stored on the survey link, and we can reach out to you if that's something moving forward.
If it's okay, I'm just going to ask my question. I'm curious. I moved from the big city to a small city recently, a couple of years ago, and I've really noticed how many more complications there are in trying to get access to specialized rehab services. And so I'm really glad that you have you're trying to look at the differences between urban and non-urban people. But I would definitely sort of encourage in the qualitative semi-structured interviews to lean more toward that, to sort of sample into the area where there's likely to be less service, because I think that's happening a lot. And our providers on the island or in the north aren't set up necessarily for telehealth or telemedicine. And then, you know, you can't get Botox by telemedicine. So there's a lot of those barriers that I think really need to be captured, and it's great that you're looking for them.
Jocelyn, we are totally with you. Our team already had multiple meetings, and we really looking for the participants from urban community. I approach all my patients who I saw from Kamloops, Kelowna. Many of them did survey, but we really encourage guys, if you, and I know you're working hard, you and Terry sent numerous requests to BCSCI communities. That's a please help us.
We will continue to work with you on that. It's an important one.
Yeah.
I had one like personal message that came in, question for you guys. If anyone happens to know the best place to go get a COVID test done if you have an SCI.
Huh. If somebody will tell me, please inform me.
I don't think you really have a choice a lot of the time. You just call 811 and they tell you. And we may have heard a little hint that people don't know about, which is terrible. But if you think you need a test and you call 811, tell them you're in a chair, tell them if you have a disability, and they will work with you to organize someone either to come to you or to make sure that the place you're supposed to go for testing is accessible. Why that's a secret, I don't know. Anyone else have any questions before we wrap up?
Okay, I truly appreciate again help and support of BCSCI. Stay healthy, everybody. Exercise as much as you can, and I will talk with you in a couple months. Again, thank you all students and all my colleagues.
Thank you, Dr. K. That was wonderful, and all the team that helped you in the presentations. That was a really good job. Thank you so much.
Thank you, Dr. Wolf. Thank you. Bye.
Thanks,
Bye, everybody.
everybody.
Thank you.
Thanks, everyone. Nice job.